All right, you guys are live.
22%. The survival rate of women with metastatic breast cancer 5 years after diagnosis. 22%. That means approximately 1 in 5 women diagnosed with metastatic breast cancer will be alive, enjoying the privileges that we take for granted every single day, 5 years after their diagnosis. 22%. Sid, Olivia, and I believe that Ibrance, also known as palbociclib, can change that number.
So Ibrance was approved by the FDA to treat metastatic, ER-positive, and HER2-negative breast cancer. ER-positive breast cancer involves the overexpression of estrogen receptors in cells. HER2-negative, on the other hand, the cells do not overexpress HER2, which is a growth factor receptor. And metastatic breast cancer is in stage 4 and has spread past the breast and lymph nodes to other parts of the body.
So how does ER-positive breast cancer work? When an estrogen signal is received by an estrogen receptor, the MAPK pathway is activated. Downstream, this leads to cellular proliferation. What makes breast cancer cells so different from healthy cells is that breast cancer cells in ER-positive breast cancer have an overexpression of these estrogen receptors, and this leads to a higher rate of proliferation, which could lead to tumorigenesis.
The current therapies to treat breast cancer include hormone therapies, chemotherapy, surgery, and radiation. Hormone therapy is when estrogen is targeted, so the production of estrogen is either inhibited or estrogen is blocked from binding to receptors. And the hormone therapies are very successful in treating the early stages of breast cancer, but once it spreads through the body, it's not as good of a treatment. Ibrance was approved by the FDA on February 3rd of this year, and it's currently in a phase 3 trial. It's manufactured by the company Pfizer. It was approved for use in treatment with combination of a drug called letrozole, which we'll explain later, in postmenopausal women with ER-positive, HER2-negative metastatic breast cancer. And it's taken orally in capsule form every day for 21 days, and then the patient stops taking it for 7 days, and then the cycle repeats itself. Ibrance does treat cancer cells, but it does also affect healthy cells, so there are still side effects that go along with taking this drug. Some of these side effects are infection, nausea, vomiting, tiredness, diarrhea, and mouth sores.
So how does Ibrance work? Ibrance is a CDK4 and 6 inhibitor. CDK4 and 6 is essentially the G1 CDK. And Ibrance binds to the active site of G1 CDK, inhibiting G1 CDK from phosphorylating RB. If RB is not phosphorylated, E2F cannot be released, and the cell cannot go into S phase. So essentially, when an estrogen signal is received, the cell cycle arrests between G1 and S phase checkpoint. So how do we know that this works? So in the phase 2 trial that granted Ibrance its FDA approval, the scientists came up with an IC50 number of Ibrance on CDK4, 6, 2, and 1. An IC50 number is a measurement of how effective a drug is at inhibiting a biological mechanism or molecule. The lower the number, the more effective the drug is at inhibiting that molecule or mechanism. So as you can see here, Ibrance had a substantially better effect inhibiting CDK4 and 6 as opposed to CDK2 and 1. So we can conclude that Ibrance selectively inhibits CDK4 and 6. This is important because in the past, other cyclin CDK inhibitors have been developed, but they've been found to inhibit multiple cyclin CDKs, causing immense amount of side effects. And this selective inhibition of Ibrance makes it very unique.
Are there any questions?
Why would inhibiting CDK4 and 6 be better? Will that inhibit proliferation better, or just affect?
Well, it's better than the other drugs because when they found that when multiple cyclin CDKs were inhibited, there was too many side effects. It was just too damaging to healthy tissue. So Ibrance is unique because it only inhibits cyclin CDK4 and 6.
What's the part on the right you have?
IC50. It's a measurement of how effective a drug is at inhibiting a molecule or biological mechanism. So these lower numbers here mean that Ibrance does a better job at inhibiting CDK4 and 6 as opposed to CDK2 and 1.
But how does it, is
Is it judging by the presence of molecule or something?
So I don't really know how the formula, how they come up with this number, but in the paper that we found this, they said that they took into account things like RB phosphorylation, which is downstream from the G1 CDK, and how many cells were arresting in G1 and S phase. They never gave really numbers on that of the RB phosphorylation and how many cells were going between G1 and S, but this is the only really numbers they had.
So letrozole, as we briefly mentioned before, was approved by the FDA to be used in combination with Ibrance. And what letrozole is an aromatase inhibitor. So aromatase is an enzyme that when androgen binds to the active site of aromatase, it turns androgen into estrogen. And so when letrozole is administered into the patient's body, letrozole's job is to bind to the active site of aromatase, therefore inhibiting androgen from binding to the active site of aromatase. And you can say that the production of estrogen is decreased from that. So to back up the statement that I said previously on how letrozole decreases the amount of estrogen or estradiol produced, this study was conducted on 52 women who were postmenopausal and had metastatic breast cancer over a period of 14 months. And as this graph clearly shows, letrozole does decrease the amount of estrogen produced over time. Any questions?
So
No.
Could you explain the correlation between the previous slide? Go back. The correlation between aromatase and then
So, like I said before, Nick, when androgen binds to aromatase turns androgen into estrogen. And so when letrozole is administered to the body, it takes up that active site, so androgen cannot bind to aromatase, and therefore estrogen cannot be produced. So the production decreases. Yes.
Is it dangerous for those CDKs to be inhibited if there isn't any estrogen production, so the cells wouldn't be metastasizing or wouldn't be growing, I guess?
Well, there are more growth factors and stuff. Obviously estrogen is not the only growth factor. There's mitogen and EGFR, but it's not just estrogen.
Was estradiol?
Yeah,
It's
estradiol.
It's estrogen.
Yeah.
So how do Ibrance and letrozole work together? Ibrance works to inhibit CDK4 and 6 in order to cause cell cycle arrest in cells that have already began to undergo mitosis. While letrozole works to decrease the amount of estrogen to prevent cells from receiving estrogen growth signals in order to proliferate. So together, these therapies delay the disease progression by inhibiting cell proliferation in cancer cells.
Okay, so in this clinical trial, 84 patients were given both Ibrance and letrozole. Palbociclib is just another name for Ibrance. And then 81 patients were just administered with letrozole. And you can see that the progression-free survival rate was much lower with the patients who were just receiving letrozole than the patients receiving both drugs. Because the patients who were getting both drugs, it's working as like a double barrier in the pathway. So if estrogen is still being produced, then later in the pathway, Ibrance can stop the cell from proliferating.
Questions?
Could you just go back? I think it's one slide. Yeah, just say one more time, how what they
So Ibrance works to inhibit CDK4 and 6 in order to prevent cells that have already started to undergo mitosis to arrest, so they don't proliferate. And then letrozole works to decrease the production of estrogen to prevent cells from even starting mitosis in the first place.
Okay. So why should Ibrance replace current breast cancer treatments? Because it's taken orally, it's a non-invasive treatment, and it has a better time treating metastasized cancer cells because unlike radiation and surgery, which are more localized treatments, Ibrance is taken orally, so it goes to the whole body.
So as Matt said before, palbociclib selectively inhibits G1 CDK and not other CDKs. You see, a common problem with this is that other CDK inhibitors is that they inhibit multiple CDKs, which leads to a lot more side effects because they're affecting more healthy cells.
So hormone therapy is very effective in the early stages of breast cancer. In fact, stage 1 survival rate, 100%. Stage 2, 93%. And stage 3, 72%. But then stage 4, metastatic breast cancer, that number drops all the way back down to 22%. Ibrance's ability to cause cell cycle arrest in cells that have already started mitosis, and letrosol's ability to prevent cells from even starting mitosis, can bring that number up substantially. Thank you.
It's over.
Yay. Were you the last one?
I'm still
We have,
Okay.
You're still stressed?
we have about 4.5 minutes.
I can't do it.
Next question.
I can't do anything with that.
I don't have a question.
Alright. So if this drug is orally administered and it targets CDKs which are inside the cell, versus many of the other treatments that we've seen, which is mostly affecting receptors and basically the outside of the cell, how does this get into the cell?
That's a good question. We couldn't find much on that, but from what we could gather, we could kind of infer that it simply just passed through the membrane. There wasn't really a receptor that took it into the cell. It just kind of passed through the membrane, but I could look more into that and get back to you.
All right.
Oh, got a
Well,
question?
I was just gonna say, you guys were talking about it was you're closer to the beginning, but it was about the FDA approval, and then it also said phase 3, so I was kind of confused. So is it FDA approved or is it in stage 3?
Yes. So actually, it got an accelerated approval because it was so promising in its phase 2 trial. So what they're doing now is they're researching more specifics, like what we were talking about before, like more specifics on how the mechanism is working and if it's really working. But since the phase 2 trial with the progression-free survival rate was so promising, they granted it and accelerated approval. So they're just researching further.
You have to get approved to have a phase 3 trial by the FDA because phase 3 is with humans, so you have to get approved for that. So stage 2.
Where did this Nick come from?
Yeah.
This incredibly helpful, knowledgeable Nick is a little bit frightening to me. All right. Oh.
What is different about Ibrance in comparison to the other G1 CDK inhibitors that allows it to selectively inhibit the specific G1 CDKs that you guys were looking at?
It's the structure. So basically, the structure of Ibrance is very specific to the active site of CDK4 and 6, as opposed to the other CDKs. So since cyclin CDKs, they all have a CDK common part. They're very effective, very similar in structure. So when these drugs would bind to many of them, but Ibrance, the structure is slightly different, and it binds selectively to CDK4 and 6 as an active site.